Have you been troubled with lower back pain or perhaps sciatica from a slipped disc for quite some time? And maybe you're wondering if endoscopic spinal surgery is a potential solution because it sounds minimally invasive. My name's Anthony Ghosh. I'm the director of the Spine MDT and a consultant spinal neurosurgeon. In this video, I'm going to discuss endoscopic spine surgery, when it may be helpful, and what I believe to be its potential limitations. Over the years, with technological advancement, spinal surgery has become less and less invasive. Typically, we carry out surgery to take pressure off nerves in the spine, as shown here. This operation is called a lumbar discectomy. So here we have a cross section across the lumbar spine where there is a slip disc, this area here, pinching this nerve, sending pain down the leg. Traditionally, this type of operation many years ago was carried out through a great big open wound in the midline. This big arch at the back of the spine was removed, and with the naked eye and instruments we'd remove this bulging disc here. With improvements in technology, microscopes and various retractors, we're able to do this through far smaller incisions, meaning less disruption of the muscles and then removal of the disc. And then later we've developed endoscopes instead of a microscope looking down a tube, if you like, with a camera attached to it that gives you a similar view. One of the advantages is that the tip of the camera is much closer to the operative view. Therefore, closer to the skin, you can actually get away with a slightly smaller incision than you would with the standard microdiscectomy approach, because you don't have all this other tissue in the way and shadows from the surrounding tissues getting in the way of your view. However, in my opinion, when you use a microscope, you have a binocular view. You have a goggle for each eye, giving you greater depth of field and, in my opinion, a better view. Studies have shown that the intraoperative stay is less and the postoperative recovery thereafter is also shorter. However, in all areas of medicine and surgery, we have to look at the literature and the evidence critically. Many such studies have been carried out in centres that have a high volume of endoscopic spine surgery, so there is an element of bias. There's an old saying in surgery that surgery is not an exact science, but a fine art. Microdiscectomy, already a significant improvement over the traditional open discectomy and far less invasive, can lead to patients going home the same day with really good results. Therefore, for surgery where we are approaching the spine directly from the back, my personal preference is the microdiscectomy. I feel I get a much better view through an already minimally invasive technique. Sometimes a disc herniation can be a bit more lateral, as shown in this diagram here. Here is the midline, and we would normally approach a disc through this approach here, but when it's lateral, this approach is actually suboptimal. We would normally come at it from a slightly different angle, and I've described this in a separate video called the far lateral discectomy, but this is where I think the endoscope may be more powerful. If we come in from the side directly, as shown here on this side view where the disc bulges and catches this nerve here at this window, this is known as a transforaminal approach. The narrowness of the endoscope itself can actually get us to the disc underneath that nerve quite nicely. Lumbar fusion, where a construct of screws and a rod is placed in the back of the spine to stabilize a segment, the disc is removed and a cage is placed in, has advanced to a minimally invasive technique through two very small incisions. The endoscope has more recently been used in this procedure to try and make it less invasive, where through an even further smaller incision, the cage is placed and the disc space is cleared out. Also, if you are carrying out lumbar fusion to correct a spondylolisthesis, demonstrated here where one bone has slipped forward over the other bone, the endoscopic method can be limited in its ability to realign the spine and correct that spondylolisthesis, as demonstrated here with the traditional minimally invasive approach. Whilst I have undergone training in endoscopic spine surgery, I believe in a team having a range of techniques in their arsenal so that the right technique is chosen for the right patient to achieve the best result. I really hope you found this video helpful. If so, please click that like button and do subscribe to the channel. Also visit us at spinemdt.com to see how we can help you. Thank you very much for watching.